Hey guys, welcome back to the Pulling Curls podcast. Today on episode 101, we are talking about why evidence-based birth is wrong. It's not wrong. Hello, clickbait. Let's untangle it. Hi, I'm Hillary Erickson, the curly head behind the Pulling Curls podcast, where we untangle pregnancy, parenting, home, and even travel. We know there's no right answer for every family, but hopefully we can spark some ideas that will work for yours. Life's tangled, just like my hair. Okay, guys, before we get started, now is the time to subscribe. It's 100% free. You know, there's those podcasts that charge you. That's not me. Just subscribe. Thanks. Okay, guys, today's guest has 20 years of labor and delivery experience. She is the mom to 4, and she had 2 NICU babies. And I have to say, she did not have like the picture perfect deliveries as the labor nurses do. I want to introduce my friend, Carrie. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Hey, Carrie, welcome to the Pulling Curls podcast.
Hey, Hillary, how are you?
Oh, Carrie trained me at my last job for like 1 full day, right?
Very scary.
Oh, when we were in the OR and we couldn't figure out how to mix that thing.
That's right. I forgot. Yeah, that was my first time too. And I was training you at the same time. And the doctor didn't know how to use it either. Good time.
Yeah. I mean, you have to realize that a lot of nursing is like that. And honestly, every time I would mix it after, I would think of Carrie.
I don't think I ever mixed it again. It was just with you. So
I probably only mixed it like 2 or 3 times later.
You're the curse. That's what I'm saying here.
Thank you.
You're welcome.
Thank you. Appreciate that.
Anytime.
Okay. Before we get started, I want to tell everybody that I love evidence-based birth. I think it's so important that patients understand the studies and all the things that support why they're making the choices they're making. Don't you think, Carrie?
I agree. Yeah. And it's good to know the evidence that's out there so you can educate yourself.
And because the evidence changes.
Often. Yeah.
Yeah. We have a very different population than when I started 20 years ago.
Yeah, for sure. There's a lot more people that are getting pregnant now with a lot of underlying health conditions that didn't 20 years ago when we started doing this. So,
no.
Yeah.
Well, especially in my hospital, I delivered like a ton of 16-year-olds. So they didn't have time to get underlying health conditions.
No, they were too healthy.
Okay. And Carrie and I were talking before we started that a lot of times, a lot of what we do in labor and delivery, you guys are going to hate this. It's just like, this is what we do. We were talking about eating. Yeah. Because evidence-based birth shows that eating really isn't that big of a deal. Like the risk of you aspirating as a normal, healthy human is pretty small.
Pretty small, but we really push no eating and drinking when you're there. So I'd always tell my patients, like, before you come in, make sure you get something to eat and drink because we're going to starve you. So, yeah. So if you're heading into the hospital, get a good snack because your labor could be long and you're going to get hungry.
Yeah. And here's the newsflash. Carrie and I can't feed you.
We can't.
Like, we can't take a tray of food in there. But if your husband goes out and gets you a burger, I'm not going to slap that out of your hand.
Yeah. I mean, only if I wanted to take a bite, but that's about it because I didn't get a lunch or something, you know.
I mean, I'd probably educate you on the fact that you might see that again, and then I would just put a little barf bag by you.
Yeah. I mean, we see it all the time, the barf, so we can handle it, but it's not always the most fun thing when you're in pain and then throwing up.
Yeah.
I know from experience. Yeah.
No, not fun. And I don't ever want you to be like, well, you didn't tell me I might throw up.
That's true, right? Kids are like that. Well, you didn't tell me. I'm like, I thought it was implied. So I guess you're right. Yeah. We got to let you know.
Yeah. We need to give informed consent for everything.
Yes,
yeah.
For sure.
If you ride through that puddle, you might get wet.
Yep.
Okay. So I just want to going in, there are things, and especially in specific hospitals, when I've changed hospitals. Carrie, did you work at that one hospital the whole time?
No, that was my second. So.
Okay. And as you change hospitals, each hospital has their own weird cultural things that they may just do at that hospital because it's kind of like the culture of that hospital. And that doesn't mean that you can't make a different choice.
Yeah. And I think it's based on geographical area too, right? Like, the women that you've been around or whatever, they've chosen certain things and they've talked to you about it a lot. So you just assume that's the way it's done everywhere else. And then you move for your second pregnancy, like, wow, you guys do it differently here. It doesn't mean it's wrong. It's just different.
Yeah. Just like there would be a different culture anywhere about anything, like school, church, all those kind of things.
Yeah.
So anyway, love evidence-based birth. Use it, use it, use it. But there are some times where it goes awry. Mm-hmm. So again, we were talking about eating. Yes, I think you probably should be able to eat in labor, especially light snacks. I would not have your husband bring you a hamburger and eat the whole thing.
And I don't think you want to. You just don't feel like eating that much, but a little bit is good.
Yeah, maybe take a bite of his and then have something small on the side.
Yeah, and I wouldn't do it like after epidural or anything. I don't think. Kind of like early labor, when it's normal to eat and drink. Like if you're at home laboring, you would eat and drink there.
Yeah, but there are specific times that you really shouldn't eat or drink, right?
Again, like your epidural, right?
Or if we really think there's an impending C-section, a very likely C-section.
Yeah, if you've got any fetal distress. Yeah, any fetal distress.
Yeah. So even though evidence-based birth says it's safe to eat and you're going to come in with that headline in your head, the reality is it's not always safe to eat because if you're looking at a close C-section that is very likely, it's really not that safe to eat because, while it is very unlikely that you'd throw up, if you really ate a meal and then had a C-section, you're not going to feel that great and it's not going to be good on your intestines either.
And I can think of two other circumstances. If you're doing a VBAC, which is a vaginal birth after cesarean, I would probably avoid food at that point too, just because there's more of a risk that you could have a C-section. So I'd probably avoid it at that time. Also, I think like if you have twins or any multiples and I guess just twins then, and you're trying to do a vaginal birth, I'd probably avoid it at that point too, because your chance of cesareans will higher than just having one baby in there.
Yeah. Although for either of those, if you were still in early labor and we just had you like at the hospital, you still probably could eat. I would definitely talk with your healthcare team, but I would agree, especially with twins as you get close to delivery.
Yeah, I think about it in the back of your head, and follow your instincts, as moms, even if it's your first baby, you're that mom of that baby and you follow those instincts. What you feel like you should or shouldn't be doing, go for it. Follow that gut instinct and ask lots of questions.
Yes. Say, I'm starting to feel a little bit hungry right now. What do you think I should do? Sometimes I'll be like, let's try an icy.
Yeah. And
see if that does anything for you. If it doesn't, then we could escalate it to like broth. We're really escalating things, clearly.
Yeah.
Definitely ask questions because, again, sometimes the provider just says, I just saw on TikTok, there was a super controversial birth where the doctor was like, come on in, your water's broken, because that's normally what they say. That's their culture. Mm-hmm. But in reality, she wanted to stay at home and labor for a while. And the doctor, once she suggested that, the doctor was like, sure, great. Just make sure nothing goes up your baby exit. Mm-hmm. And, watch your temperature.
Yeah. And I think we're so worried about prolapse cord, right? But in the reality, it doesn't happen very often. It's happened to me twice in a 20-year career that it's happened. And so prolapse cord is when the baby's umbilical cord comes out ahead of the head. And that's an emergency and delivery needs to happen immediately. So that's their concern when your water breaks and you're at home, but it happens so rarely. I don't know if you had any prolapse cords in your...
I've had 3, okay. I think.
Yeah, 2. I might have had 3, but 2 that I can remember.
Yeah. One of them was kind of like, meh. Like the head was just kind of impinging on it. So it wasn't as exciting as sometimes it is.
Yeah.
But also, your doctor could tell you, do a finger sweep up there and just make sure nothing's in your vagina. Although the ones I've had were fairly obvious. I think the person would have felt it definitely.
Yeah.
But especially if baby's moving and all that jazz, that's a great sign. Everything's good.
Yeah. And I mean, I feel like you labor better at home than being stuck in a bed because we'll pop you in a bed and sit you there. I mean, you can get up and walk, but you're on monitors and that kind of thing. So it's not as free of an environment as it is at home. So if you're feeling like everything's going well, but if you ever feel like, I just don't feel right, come on in, come in. Anytime in your pregnancy, you're like, I don't feel good. Come in, get it checked out. It's okay. You might get sent home, but it's okay.
Yeah. I mean, that's really what we do for most of our triage patients is reassure them. Mm-hmm. And we're happy to see a great looking baby too. When somebody comes in with saying their baby's not moving, we're just as nervous as you are at that point.
And we get just as excited when we see that baby moving around and the tracing on that baby's heart rate looks good. We're like, yes. So, yeah.
Yeah. Cause I would say that most of the labor nurses have been in that position too, where they're like, I'm not feeling the baby move.
Yeah.
And then you eat or drink something and you're like, oh, there they are.
There they are. Yeah. It's scary, sometimes. So if you're ever worried, just come in and get it checked out. No one's going to make fun of you. So we're all just as
Yeah. And don't forget your doctor's office too. A lot of times I think people come to labor and delivery when I'm like, you probably could have just popped into your doctor's office for a quick looky-loo.
And if you can't, then maybe you need to look at who your physician is. Like if that makes you nervous to either call them or pop in and see, and they're not wanting you to come in, you might want to think about changing your provider because you want to feel as comfortable as you can with that provider.
Yeah. And they should want to be able to see you.
Yeah, agreed.
Because I will tell you also that your visit to your provider is so much faster than your visit to me because I have to go through every question since you were born.
Yeah, really. Yeah, that's true.
Yeah. So I had an evidence-based birth quandary with my last baby. I did not want to have my water broken because I wanted to, let the water stay intact for as long as possible, but I stalled out.
You were just a chicken. You didn't want to feel the extra pain that can come after you're ruptured. That's what it was.
I already had an epidural, Carrie.
Oh, never mind then.
And I was being induced. But finally, I was like, fine, break my water. And then I had a baby 45 minutes later.
And that's a hard one too, because some of us feel like, I know, especially with my second one, I wanted to try and do it as natural as possible, right? So I understand that there's times that that's what we want for our delivery, and having someone intervene with that and break your water just feels like, oh, I'm not doing this the natural way, or whatever you're wanting from your birth experience. So I get it.
Or for me, it was 100% a hang up. I wanted control.
And you knew it could help speed you up, which is even more funny.
Obviously, I'd been a labor nurse for 10 years at that point, I think. Yeah. Mm-hmm.
But you're a patient at the time, When I was in labor, I'm just like, turn the monitor away so I'm not looking at it. I didn't want to be fixated on what was happening.
Yeah.
I'm like, I need to trust the people that are here to take care of me. Turn it away.
Yeah.
So.
All right. So what I love about evidence-based birth, and there is an evidence-based birth podcast. I'll put that in the show notes. There is a website. There's lots of evidence-based birth is a trademarked thing, but there's lots of different evidence-based practices that you can follow and just kind of find someone that you like that teaches in a way that you like and understand. But also that's why you have a doctor that hopefully has lots of experience, right?
Yeah. And I think you need to ask questions, right? If they're saying, I want you to do X, Y, Z. Well, why do you want me to do X, Y, Z?
Yep.
Because sometimes you're just like, I'm not doing that. If you think of any kid, I'm not doing that. But if you explain why the thought is that we're going to do whatever we're going to do, then it helps you to understand more, and then you can make a more informed decision. There's nothing like making a decision when you have no clue what you're talking about. So ask your doctor, and every time you go in for your OB appointment, there's always questions that you have. Just write them down. And if you've heard something from a friend, write it down. What do you do in this situation? Are you wanting me to do X, Y, Z? Or what's your thought on an episiotomy? Those kind of things, write them down and figure out what your provider does so that when you finally get to that day that you deliver.
Yeah. I'm always about having the notes app in your phone with full of questions for them. So
I'm so old school. You hear, write it down. Yeah, I'm an old lady. So there you go.
I'm trying to think what I did back in the day. I think I had a notebook in my bag.
Yeah, I wrote it down. So I'm old. So my youngest is 15 now. So it's been a while, but yeah.
I mean, by the time I had a phone, like a smartphone, I just told the doctor what was going to happen because I'd been a labor for so long.
Let me tell you my birth plan. Okay.
All right. So go to evidence-based birth, ask lots of questions. Oh, I was going to tell a story. So I was in with one of our doctors, and all of a sudden she's just very proficient practitioner, just did not, all of a sudden she was like, I do not feel good about this. Just like the mommy gut.
Uh-huh.
And this was somewhat unusual for her. And so she just told the patient, I don't feel good about this. I think we need to go back for a C-section. And obviously not evidence-based at all, right?
Uh-huh.
And when she did it, she's not a high C-section rate, does not like C-sections. I walked out of the station with her and I was like, are you okay? Do you need some sugar? What's going on? And she was just like, I just don't feel good about it. And we got back there, and actually before they cut, a little fist popped out of the uterus.
Oh man, a little bit of weird rupture there.
Yeah. And I was like, whoa. So as much as there is mommy gut, an experienced practitioner really can she was like, there was something that I felt about the strip. There was something I just felt, and I felt like we needed to go back for a C-section. And so her uterus could have ruptured while she was in labor is kind of what we figured. She hadn't had a previous C-section. Things were looking a little iffy. but not crazy. She just felt like we should go back. So sometimes evidence is awesome, but also is intuition just for moms and also for providers. So
yeah. And if you develop that relationship with your provider, when they say that to you, it's not going to be a shock. You're going to be like, well, I know him or her. We've had this relationship over these 9 months.
Yes.
And I'm going to trust what they're saying to me.
Yeah.
But then there's those times you get those crazy providers and you might figure out who I'm talking about in this scenario, but he or she would say, like, if you go home right now, your baby could die. And I'm like, really? Like, we don't, that's not the thing that we want to say to people. Explain why you think that, not that scenario. Like, if you go home, this is going to happen or could possibly happen, I guess you would say, and just kind of give you that fear, but explain why you might think that to this individual, this mom, and explain why you're feeling that way as a practitioner. But I think it was more based on time. I mean, we have a lot of providers that their time is important. So if they're already over at the hospital with you, they want to, induce you or whatever. So
yeah. I mean, the thing with that statement is at any point in time, your baby could die. You could go get in your car and you could die. Like, he could say that statement just as easily. That's probably most likely.
Yeah. But I just wish she had given some background. So like the previous doctor you talked about, she said, I'm not sure why, but this is the feeling that I have. If that's really the feeling he had, then explain it to your mom, to the mom and why. So
yeah. And she did go over, she said, I'm seeing these things on the strip. I know that you've had previous deliveries, but because she had been this person's doctor for a while. So she had done her other deliveries and was just like, the last one was a little bit rough. I'm just combining all of these different things and made such a good call. So
yeah, for sure.
Yeah. The key is collaboration.
Right. You're a team. It's called a healthcare team, right? And you're involved in that team. You have your doctor, your nurse, your neonatologist, if one's involved in your case, because you might be having a premature baby or a baby that has some conditions that need a neonatologist there, as well as you and your significant other too. Like, that's your team. Together, you work together to get the outcome that's best for you and the baby.
Yeah. And a lot of times I think everyone thinks the healthcare team are the people wearing scrubs.
And they're not. Like, you're involved in that team.
Yeah.
And it's okay to speak up and say, I'm not really sure about that, or I don't want to do that. And why do you want me to do that? And that's totally cool.
You have the ultimate right of doing that in the room. The nurse does not have that much right.
Yeah. If you see the nurse sitting there rolling her eyes, that's probably a good indication that you might want to ask some more questions. Or if you ever hear a nurse say this to you, it's up to you. You get to decide. You get to make your own decision. I would have a little red light go on in my head going, okay, why is she saying that? Because you can't say something like that. This is crazy. You shouldn't be doing this. So if a nurse ever says that to you, say, okay, why is she saying that? There might be something to this that I might need to consider, not doing this or doing this. So
yeah,
I don't know if you've ever said that or not. So I've said it before, and I'm like, probably could get myself into trouble, but really I feel like you need to ask some more questions. You need to know why this decision's being made, and do you really want to follow through with it? So yeah.
And on the converse side, when I 100% agree with the doctor, I probably wouldn't drive down that train of like, you can make your choice as I'm watching lates after lates after lates.
Yeah. Then you're kind of nodding your head with the doctor when they're, telling you what they want to do. If the nurse is nodding her head, that's a good indicator too, that she probably, or he probably agrees with that statement. So
yeah. Thank you for coming on, Carrie.
Thank you. It's been awesome.
Yeah. So fun to chat with you.
I miss you a lot. So
everybody misses me.
It's true.
Okay, guys, I hope you enjoyed that episode because I love evidence-based birth, but sometimes I have people who bring up evidence-based birth in a situation that's very unique to themselves. And I just want to tell you that is difficult. That's why you have a provider. Evidence-based birth is for the masses. And when you're looking at just one specific person, then things change a little bit. So just something to keep in mind. Thanks so much for joining us on today's episode. We know you have lots of options for your ears, and we are glad that you chose us. We drop episodes weekly, and until next time, we hope you have a tangle-free day.